Good morning to everybody. I want to thank the scientific committee for the kind invitation to this wonderful event and to let me share my daily work with all of you. The topic I've chosen for today is related to the interdisciplinary aesthetic approach when dealing with tooth and implant restorations. The contents of my lecture are based on this fundamental literature that I highly recommend to you all for further information. Even though an implant therapy may look simple, there are three different disciplines that should work together along the timeline of a treatment. Chronologically, the surgeon, the prosthodontist, and the dental technician should speak the same language. This communication must be even stronger when we deal with aesthetic situations. In accordance with this idea, along this treatment, all the team members were involved in preparing the next step for the following colleague. However, there are certain situations that much more than three disciplines should work. So in this particular case, prosthodontic planning, periodontal surgery, orthodontics, implantology, and adhesive ceramic restoration were linked together along the timeline to change the characteristics in terms of health, aesthetic, and function for these patients. So we need to address some factors that we should analyze